Hello, my name is Dominique Lassade and I'm a nursing student here at Barry University. Today we will discuss bullying in nursing. Bullying causes physical and psychological symptoms that lead directly to medication errors, unsafe patient care, and adverse patient outcomes. A recent study in 2009 revealed that 56% of bullying cases were committed in the nursing educational setting. A lack of awareness and training and knowledge leaves a nursing student feeling vulnerable to bullying. In response to this alarming trend, here at Barry University, we passed a resolution implementing training for nursing students and intervention strategies. On behalf of the Nursing Student Association, we hope to bring awareness to bullying and, more importantly, put an end to bullying by speaking up and speaking out.
Bullying is defined as repeated, unreasonable actions of individuals or groups directed towards individuals or groups, which are intended to intimidate, humiliate, degrade, or undermine, or which create a risk to the health or safety of the employees. Bullying violates the ethical principles that are paramount to nursing, which is to respect the dignity, worth, and human rights of all individuals, including colleagues. Bullying threatens the well-being and safety of both patients and nurses. Verbal abuse is the type of abuse most often seen in nursing.
Recognizing bullying, unwarranted or invalid criticism, unjustified blame, unequal treatment, exclusion, social isolation, humiliation, unreasonable demands, verbal abuse, and denied opportunities.
Why does bullying occur in nursing? A nurse's inability to speak up and speak out contributes to bullying in the profession. Power imbalances related to formal power structures or perceived power structures, gender and minority status, all of these things may contribute to nurses feeling powerless. This may result in anger and frustration and the nurse's inability to be assertive. Male nurses report more camaraderie with male physicians than female nurses, and there may exist less bullying among male members of the profession than in female members. Displaced and self-destructive aggression, nurses feeling overwhelmed, and ineffective communication and coping skills contribute to bullying in nursing because of the high-stress, high-stakes environment that we practice in. What's needed is a culture change, zero tolerance. We need to start this before nurses enter the profession.
Examples of bullying behavior are being yelled at, screamed at, or humiliated in front of others. Being nonverbally intimidated, eye-rolling, glares and stares, being accused of errors made by someone else, being the subject of gossip or the topic of rumors, being assigned undesirable work, being sabotaged, having your thoughts or feelings ignored, being excluded from activities or conversations, being physically threatened.
The following are possible responses to possible bullying issues in the nursing profession. Being yelled at in front of others.
I do not appreciate being yelled at in front of others. It doesn't set a good example for the group. If there's something you need to discuss with me, let's do it in a more private place.
Nonverbal abuse.
I sense there's something you'd like to say to me. Do you want to discuss it?
Overhearing someone talking about you.
If there's an issue we need to talk about, please come to me directly so we can discuss it.
Backstabbing, or complaining about a person to someone other than that person.
I don't know the facts about the situation, and therefore I don't feel comfortable talking about it.
Lack of respect.
I do not like to talk about others without their permission.
Who can you go to for help? Your Barry University NSA board members, your faculty advisor, or your Barry University NSA faculty advisors, which is Professor Schwal or myself.
The following are possible situations where a student may have felt like they were a victim of bullying. After each scenario, we will pause the tape for a discussion.
A student in one of my clinicals wears her hair natural in an afro, appropriately pulled back. Our professor addressed her in front of all of us, telling her that her hair resembles a bird's nest and she should be ashamed to wear it that way outside of her home. The student responded by saying, "Thank you for sharing your opinion," and walks away to continue her day's work. Later on that day, the student emailed the clinical coordinator for the course to inform her of the event. The clinical coordinator met with the clinical professor, and we arrived at clinical the following week. We found the professor had been replaced.
I am very quiet and shy in the school environment, and people tend to take advantage of that and my kindness.
I noticed that there are many cliques, and my nursing class is very segregated by ethnicity and nationality. I wish that we could be more integrated and be able to converse, share, and study together. One day I came to class and went to sit down at the front of the room so I could hear the instructor better. One of the students sitting there told me to find another seat because she was saving that seat. I hope it wasn't because I am from a different culture than the students already sitting in that row.
I'm one of those students who have always participated in class and like to answer questions. Lately, I've been noticing that every time I raise my hand to answer a question, other students in the class are snickering or rolling their eyes. I'm sure they think that I can't see or hear them, but I can. I only want to do the best I can in the nursing program, and I feel that I'm starting to shut down in class. I don't know what to do to turn this around.
One of my fellow group mates is constantly undermining my contributions to the group project. She tells me I'm stupid and don't get it, but she never explains herself, and I don't really know what I've done to make her act that way. She has destroyed my self-confidence, and now I find myself doubting if I have what it takes to be a nurse. I can't sleep at night worrying about what she'll say to me the next time I have to see her at school.